This presentation is on the Hi-OxSR sequential rebreather and its use as a novel treatment for long COVID-associated cognitive dysfunction. The presentation will discuss the mechanism from COVID that may be responsible for the cognitive dysfunction, and then how the Hi-OxSR may be able to reduce the dysfunction. COVID is known to inflame blood vessels. The inflamed vessels in the brain narrow and reduce blood flow to the brain. As shown in the images on the right, a simple halving of a vessel's diameter will increase the resistance 16-fold. That means for the same blood pressure driving force, the blood flow to the brain can decrease to 1/16 the previous flow. This reduction in flow can starve brain cells from oxygen and nutrients. The Hi-OxSR was originally developed as a diagnostic tool for evaluating how the blood vessels in the brain and eye reacted to stimulation. This became part of the workup for brain tumours and stroke management. By controlling the CO2 in the patient's blood, we were able to rapidly change cerebral blood flow. In this image, the circles in the figure are the exhaled CO2 concentration, and solid line trace represents changes in cerebral blood flow. If you look at the timeline, you can see that within seconds of changing the CO2, the blood flow to the brain rapidly responded. The physician who heads the long COVID program for all of Canada ran a pilot study with treatment for 14 days. The participants were tested at baseline and then again at the end of treatment on day 15, and then they came back 30 days later for repeat testing to explore whether any improvement was maintained. The tests included 7 measurements of memory and executive function, and 1 brain fog questionnaire that evaluated their quality of life. On these graphs, the people indicated with the gold lines are those that improved. 75 to 80% of the people improved during the 14-day treatment period, and several of them found further gains 30 days later. Note that for the executive function testing, higher number are better performance. For the quality of life brain fog questionnaire, a lower number is better. You can see that the treatment was not loved by everyone, and the quality of life for some people was slightly worse on day 15. However, 30 days later, there was a dramatic improvement in their quality of life. So why does breathing carbon dioxide improve cognition? Increasing CO2 increases oxygen delivery. It's because it can increase cerebral blood flow by 20 to 60%. There are also other possible mechanisms that can address cognitive function. CO2 has some anti-inflammatory properties. And since COVID is an inflammatory disease, whatever anti-inflammatory activity is provided by the CO2 would be beneficial. Additionally, CO2 can upregulate serotonin in the brain. It is known that people with long COVID have reduced serotonin in their gut, and with the gut-brain relationship, increasing serotonin in the brain might also be beneficial for influencing a sense of well-being. The Hi-OxSR has several unique features that enables providing CO2 in the inspired air without using an external tank of CO2 by using your own exhaled CO2. For effective treatment, the mask needs to seal tightly to the face. Therefore, the mask has dual head straps and foam around the nose to create a tight seal. It has no holes in the mask, as is found in usual oxygen masks, so that there is no dilution with room air when you breathe in. There are multiple valves in the mask to control the flow of air, including a valve to allow exhalation into the rebreathing tube and a sequential rebreathing valve that enables inhalation of the exhaled air sequentially after inhaling the oxygen in the oxygen reservoir bag. When you breathe out, your exhaled air, the red arrow, flows out the exhalation valve into the rebreathing tube. Oxygen from the oxygen concentrator, the green arrows, flows into the oxygen reservoir bag and closes the sequential rebreathing valve. The end of the exhaled air in the rebreathing tube contains air from your alveoli, your air sacs, which is high in CO2 and still high in oxygen. The reason that the rebreathing tube is long is that we need to keep your exhaled air in a linear arrangement so that the air from your alveoli is closest to the valve, and you inhale air with high CO2 and oxygen concentrations. When you start to breathe in, the first air into the mask and your lungs is 97 to 100% oxygen from the reservoir bag and the continuous flow from the concentrator. Although the oxygen flow to the mask is only 2 litres per minute, your body uses only around 0.35 litres per minute. You inhale more than 6 times the volume of oxygen your body needs. Once you've inhaled the small volume of oxygen from the oxygen reservoir bag, it collapses and the sequential rebreathing valve opens. You can then inhale the air from the last breath you exhaled, which contains a high concentration of CO2 and oxygen. This will raise the level of the CO2 in your blood being pumped to your brain. To use the Hi-OxSR, besides the mask and rebreathing tube, you will need an oxygen concentrator. It needs to be a continuous flow machine that can deliver 2 to 5 litres per minute. The treatment uses 2 litres per minute. However, your physician may want you to breathe a higher level of oxygen before or after treatment. If needed, the 5 litres per minute will provide significantly more oxygen. You can't use a pulse delivery machine that delivers a bolus of oxygen on each breath. You also need a pulse oximeter. Because CO2 is the gas that drives your breathing, this treatment will make you breathe much deeper and faster than you normally do. Somewhat like you are running a race, sitting in your chair. Therefore, you might have a sense that you are not getting enough oxygen. Your oxygen saturation will actually go up during the treatment, and the pulse oximeter will reassure you that you are getting enough oxygen. It is also a safety alert if the tubing between the oxygen concentrator and the Hi-Ox pops off the connector, in which case your oxygen saturation might fall. You need to make certain that there is no leak around the edges of the mask. If your breathing doesn't increase, you probably have a leak. While it's not the most comfortable treatment, and as I previously mentioned, several patients felt worse during the treatment, they found it worth the discomfort considering the significant benefit. Sitting back and taking pressure off your diaphragm will usually be more comfortable. The current treatment strategy is for 30 minutes, twice a day, for 28 days. As with all medications and treatments, there are always potential adverse events or side effects. These are some of the reported adverse events or side effects that have been reported by people who have used the rebreathing system. The significant increase in cerebral blood flow from the CO2 can cause a headache, which usually diminishes shortly after treatment completion, although it can last longer. Some people with a history of asthma have reported wheezing during the treatment. Although you are not running, the treatment drives you to breathe heavily, as if you were running. This increased airflow can cause a cooling effect, which may trigger wheezing similar to exercise-induced asthma. People with a history of asthma should check with their doctor as to whether they should take an inhaled bronchodilator or other medication prior to using the rebreather. Some people with chronic obstructive pulmonary disease have breathing limitations and may not respond to the CO2 or have increased CO2 in their blood without rebreathing. People with COPD should check with their doctor before using the rebreather. Nausea has been reported. Although the mechanism causing nausea is not obvious, it may be related to swallowing air. It is usually a temporary effect. Fatigue and post-exertional malaise, or PM, may be different levels of the same response of the body to the heavy breathing. A few people have reported a PEM crash after treatment. This side effect can be significant and impact on the ability to continue treatment. We are exploring use of just oxygen following treatment to minimize this side effect. Remembering that the response to rebreathing is very rapid, it may be possible to use the rebreather more often, but for shorter periods. This has not been tested as yet. Thank you for watching this video. If you have questions, you can email me at alex.stensler@twelfthmantech.com.